This is Dr. Corey Maas on Looking Your Best, and I have an opportunity today to take one of the fine young surgeons that works with me at the clinic, who spends a year with me as a fellow. And a fellow, just so everyone understands, is a very advanced training person. The fellows that I select through a matching process, they actually select me and I select them through a process called the match, which is a lot like residencies are done, have completed obviously college and 4 years of medical school and internship in general surgery, and then either 4 or more years in head and neck surgery or plastic surgery. And I've had fellows that have come from a background in head and neck and fellows that have come from a plastic surgery background, but they come specifically to the facial plastic surgery fellowship here to the Maas Clinic to learn about our specialty, which is facial plastic and aesthetic surgery. And I'd like to welcome Dr. Barnes on my interview. Obviously, we know each other quite well. And I think best in the words of a fellow, I pick fellows based on, I really don't look at their grades very much. I know he made very good grades, but he can tell us a little bit about his background. I pick it based on the letters of recommendation that they have and the quality of the person that they are, because all of the fellows have good grades and went to really good schools and their background. And I can say, as the fellowship director, the benefit, although we don't really make any money doing this, we actually lose some probably, but we get the benefit of having young people who have curious intellectual minds that challenge us all the time to explain why and how we do things. And I think that's a phenomenal benefit to me and I personally, because it keeps me thinking. Many of them have great interest in research, and they have great interest in really advancing the specialty, just like I do. And so developing new ideas and products and devices is all part of the research that we do here at the clinic, and the fellows play a major role in participating and even becoming sub-investigators in the FDA and non-FDA clinical research trials we conduct. So I've talked a lot, but I want to have Dr. Barnes talk a little bit. So Kristen, why don't you tell us a little bit about your background before you became a fellow at the clinic?
Sure. So from Mississippi originally, as you know. Went to the University of Mississippi for both college and for medical school before coming out to California, where I went to the University of California, Irvine, did my general surgery internship there, followed by those 4 years of head and neck surgery residency before moving to San Francisco.
Yes, and so I think like most people in our specialty, there's really two groups, and I think probably told you this, I tell most of the fellows that interview with me, there's two groups of fellows that come out that are interviewing in broad categories. There's lots of different. There's a group of fellows that during their training feel like they were really very deficient in certain areas of facial plastic, and especially the cosmetic surgery part. The plastic surgeons in particular that they come because they have never seen a rhino, or haven't done many, or haven't seen many rhinoplasties or nose job surgeries. And the head and neck surgery resident graduates, the fellows, often just didn't have a great experience in cosmetic. They might have had a good experience in nose surgery, but the breadth and scope of their experience in the cosmetic part of surgery is limited. And most of them have had pretty good reconstructive. What I don't remember, but tell me a little bit about your residency. You got a fair amount of reconstructive.
A lot of reconstruction, both for small skin cancers on the face and larger skin cancers or mucosal cancers in the head and neck. Did see a good amount of rhinoplasty in residency with hands-on experience as well, but was lacking in a lot of that facelift, facial rejuvenation experience, which is why I chose to come here. Right. So we did do a bit of trauma. Injectables. We did plenty of trauma. Yeah. Lots of reconstruction in that case. Some injectables with Botox and fillers and those families of medications, but not very much at the aging face, brow lift, neck lift, lower face lift, those kind of things.
Yeah, so I think those are categories that are important, and for our fellowship here at the clinic, I just think that the fellows that come, like Dr. Barnes, with already some experience are going to have a better experience than those that came with no facial plastic training. it's just because we, as we'll talk about, I mean, we ramp you right into participating as one of the members of our staff, and I think fully integrate fellows just like a junior associate in the practice. If you would, if I had a new young person join the practice, it would be the same thing, and try to get everybody, right on the same sort of thinking process and the skill set and the communication messaging that we give to all the patients right off the bat, because I think communications and messaging, as you've heard, is really, really important in what we do. So why don't you let's take an average clinic day. What let's say a clinic day where we're seeing patients, and then maybe in the afternoon we're doing a research enrollment or whatever. Tell me about what that experience is like.
Yeah, so I spend time in the room with patients, with you, and some without you as well. So going in and gathering some background information, getting to know a patient, introducing myself, finding out why they're here, kind of what they have in mind, what their thoughts are, finding out about their past medical history, past surgical history, medications and allergies that they have, kind of what else they have going on, in order to kind of provide the more fully rounded care to understand where their situation is and why they're coming to the clinic today.
That part helps us, by the way.
Yeah.
That's helpful to me, because having that, that really shouldn't change. I'll ask some of the same questions, but having that part of the documentation completed helps to be more efficient, really, for the patient and for me. So that's a good thing. And then obviously the research, for a lot of people who don't know, when we're doing clinical research, it obviously varies, and there's a complex process to getting people involved in research, but research trials require very careful consents, which we go through a process of training the fellows for how to do the proper consent. This all goes back to the Nuremberg Code and the Stockholm Agreement about human research conduct and the ethics of human research and proper consenting, that came out of World War II. Really, I mean, those go back to those days. But after proper consent of such, we call them subjects, not patients when they're in studies. But tell me a little bit about your role in the studies and how you contribute to that part of it.
Yeah, I've gotten to see most of the different aspects of the study, from planning and investigator meetings, being involved in discussions about what the pursuit of the study is, how it's going to be implemented, what are the kind of things to overcome and to control for during the study. Like you mentioned, getting consent from patients, explaining some of the process along with you about what to expect with the study, what we are looking for, and anything that we may expect to see along the way, all the way to seeing them for follow-up visits after they're per se getting a treatment with the study, following them along the way afterwards to see how they're doing, how things are changing, and just kind of being a part of the system that monitors them during that time.
Right. So I look at this when we do training of fellows, because you guys rotate too, and you spend some time with Dr. Kim. Dr. Kim's a colleague that does pretty much only rhinoplasty. I don't know if he does.
Most of his practice.
And then Dr. Newman and Dr. Seif, who's an oculoplastic surgeon, are all part of the faculty. And so we keep you busy doing operative days, not that many clinic days, but in the clinic days that you do come, I mean, you get to observe and help me, assist me with the cosmetic injection cases and whatnot. And then on a surgery day, part of my goal is because I find that the new residents in the new world of training, with resident limitations and work hours and all these rules about who's not in the operating room or who is in, don't come with the same experience in being able to really start from the beginning and set up an operating room and set up a patient and physician and all those sort of things, which we try to quickly ramp people up to being able to we do a pre-op before surgery, but actually the day of surgery, being able to get the patient ready and in the room with the anesthesiologist and the other members of the team. Why don't you, from it, in your own idea, tell me about a surgical day and what it entails for you.
Sure. Yeah, I meet the patient in the morning, who I've already spoken to and met during the preoperative visit. Talk to them and just make sure that there haven't been any changes to their medication or medical history in the interim. Go through their goals for the surgery, make sure that we're all on board, that they understand what's being done and why it's being done, and that we're all in agreement. Going through paperwork, making sure that it's all lined up and that they've got everything they need to have a successful recovery afterwards. Kind of explain to them the same thing, is that I'm there to help with that preoperative visit and to assist and to kind of get them to the point of being ready for surgery. Then I'm assisting you during the case, doing whatever it is that we're doing for those patients.
And then but you do some marking for
Yep.
once I've trained you how to do the marking, and what percentage of the time would you say I change the marks a little bit?
90%, but it's fortunately at this point of the training, it's usually
It's much
little
less.
minor.
It's much less,
corrections,
yeah,
thing
little
here and
tweaks,
there.
which I think really is just to have you guys get to that level where you can get the person from the pre-op area and into the room safely and comfortably, and learning the messaging and the things that make people comfortable, and proper marking for the different procedures we do is important. And so I was laughing a little bit because at the beginning, there's a lot of changes usually to the marking, and by the end of the year, you guys are as good as me. Maybe you have even your own ideas about marking, which you'll translate. And I think it's really important, and a question that often comes up, because I have competitors that tell people that fellows do the surgery, and I don't know, I want to hear it from your own words. I felt you're there to...
I'm there to assist, and I certainly feel like I'm being helpful during the surgery.
Absolutely.
But it's not my case, and I'm not the one doing the surgery.
So I think what the difference is, and this is because fellows, and I was the same, learn by assisting me. They learn by holding retractors and helping with suturing and helping, with the manipulate when I need the tissues moved in a certain way, or I need the head position or whatever changed. All those things give them a SUI. They become surgical first assistants. And the difference between having a highly skilled, highly trained, and expert physician that has a great fund of knowledge as a first assistant in surgery, and going to the hospital where they provide first assistance for me also. But those are technicians, they're surgery techs, and they're very good people. Many of them have a lot of experience, but they're typically high school educated. They don't have to have a college degree to be a surgery tech. Some might, but most don't. And look, I think they're great, but there's a difference between having a high school educated surgery technician and having a board eligible or board certified facial head and neck surgeon or plastic surgeon who's seeking board certification in facial plastic surgery, actually being that first assistant. It's great in many ways, but one of the most important ways I think it helps me is they ask all the right questions and challenge the rationale for why we do cases like we do. So that helps me keep on top of my game too, and making sure I'm doing them. By the end of the year, I think most of the fellows feel very comfortable with setting up on the majority of the cosmetic and facial plastic surgery cases that we do, and actually going out into practice. I'm sure by now, even it's in April, but you probably are getting a little bored, but I don't know.
Chomping at the bit and ready to go.
You're ready to go. So anyway, I wanted to introduce the fellow this year, who's a particularly great fellow, Christian Barnes, and he'll do great wherever he goes. I think Atlanta's locked in now, is that true? Athens, so good place back on the East Coast. And if you have any questions about fellowships, fellowship training, the role of fellow, please don't hesitate to contact me. I do this for a couple reasons. I want other fellows to see what Dr. Barnes' experience is like, and I also want patients to understand the role of the fellow. And they're not the surgeon for the patient, but they're integral to the care. And this is a long honored tradition in medicine, is that we pass on what we learn, and all of us have a little different nuanced things about how we do surgery. The other faculty may do things a little bit differently and from me, but they learn how we assure that we get the best outcomes for our patients and try to make the best patient experience available to each person we care for. This is Dr. Maas on Looking Your Best.